Good morning. Welcome to the Mid-America Regional Council Daily Operations Briefing for Wednesday, April 8th. Should you have any questions during the briefing, please add them to the chat function with your email address and we'll either respond live or follow up. As a reminder, the intent of this briefing is to provide clear, concise information. We've used what we feel to be the most authoritative current resources of information available. As for projections, this is a rapidly developing situation and we will use the best predictions that we have at the time of the briefing. Yesterday, the multi-agency coordination group met to discuss our collaborative response efforts now and into the future. The MAC group, as it's called, is a multidiscipline, multi-jurisdictional representation group. Their role is to enhance regional communication and to provide regional situational awareness in order to make informed decisions, especially when they impact multiple jurisdictions. They also look for opportunities to collaborate. The group will meet as needed to address issues as the situation develops. Here are some brief takeaways from yesterday's meeting. The KC Region COVID-19 Resource Hub is a regional information platform that is routinely updated with the best information available. It's a work in progress and we welcome your input about ways to improve this tool. If you have video, you can see this hub on your screen right now. The Resource Hub, along with Prepare Metro KC website, are the best sources of information on the spread of the virus at the regional by state level and actions that you can take to mitigate its effects. The hashtag #StayHomeKC campaign encourages everyone to stay home to stop the spread of COVID-19. Stay safe, stay strong, stay home. As of this morning, there are 946 confirmed cases of COVID-19 in the region, 34 deaths. This represents an increase of 56 cases and 6 deaths over the last 24 hours. We're now tracking the number of people tested in the region, 3,511 tested thus far, but numbers are incomplete since not all counties are reporting. Based on current projections, the peak of infection and resource requirements for the state of Kansas is April 20th, that's 12 days from now, and for the state of Missouri is April 21st, that's 13 days from now. This is a change from the prediction, yesterday's prediction. Again, predictions are based on the best information available today, and the situation can rapidly change. And remember, as long as it takes for us to reach the peak, it will take considerably longer until the danger has passed. Remember to stay safe, stay strong, and stay home. The status of all 7 lifelines throughout the region is green, but hampered by a shortage of personal protective equipment. Otherwise, all lifelines are functioning as required, with no mission-critical shortages of personnel, equipment, or supplies forecast for the next 48 hours. Let me explain what lifelines are quickly. A lifeline enables the continuous operation of government functions and critical businesses, and is essential to human health and safety or economic security. The 7 lifelines are safety and security, food, water, and sheltering, health and medical, energy, which includes power and fuel, communications, transportation, and hazardous materials. There's a commonly accepted color coding as well. Gray means unknown, red means unstable. It indicates the lifeline services are disrupted and no solution has been identified or is in progress. Yellow means stabilizing. It means the lifeline services are disrupted, but solutions are in progress with an estimated time to stabilization identified. Green is stable, indicates the lifeline services are stabilized, reestablished, or not impacted. The weather forecast in the region for the next 48 hours should not have any impact on our response operations. We have no outstanding questions from yesterday's briefing. Now I'd like to provide an update on supporting functions and disciplines. Public health is working on public-private partnership to be able to support more widespread testing. Public health also continues to maintain hotlines for contact tracing and general inquiries. You can visit Prepare Metro KC for a list of all public health departments' hotlines. Long-term care facilities are investigating the Centers for Medicare and Medicaid Services, CMS, allowable transportation options for individuals traveling to and from hospitals and dialysis. They're also reassessing the all-hazard plans that call for evacuating or sheltering in place. Personal protective equipment. Estimates throughout the region are that based on current rates of consumption, on-hand stocks of personal protective equipment will be critically short for all agencies within the next 96 hours. Private business is looking for ways to support the COVID response. This includes production, purchase, and delivery shipping of both personal protective equipment and testing supplies required by hospitals, public health, and first responders. To assist agencies and healthcare organizations to acquire personal protective equipment, a group of fire, EMS, and MARC staff have started meeting to look at potential sources of PPE and the possibility of group purchasing. MARC has also created a list of vendors who have a reputation for providing quality products at a reasonable cost and fast delivery. The Kansas City Regional Organizations Active in Disaster, COAD, is a body of volunteer agencies, organizations, and faith-based groups and people who come together in times of disaster to coordinate delivery of various goods and services. Today in the COAD, multiple jurisdictions are conducting homeless services and feeding operations, and homeless needs for transportation and shelter continues to be an ongoing issue. Emergency Public Communications is promoting the hashtag #StayHomeKC campaign with consistent regional messaging to stay safe, stay strong, and stay home. Pass the word. Let's get everyone to participate in this campaign. Looking towards the future, the region is considering activating its plan for long-term recovery across a range of areas, including health and human services, medical, economic, housing, and infrastructure. Visit preparemetrokc.org frequently to get valuable information. This morning, I have two more items of particular interest. The Kansas City Regional COVID-19 Response and Recovery Fund. Several community partners have joined to create the fund that is managed by the Greater Kansas City Community Foundation. It is established to support nonprofits to be able to continue their vital services and to increase their capacity to serve. The first grants are expected to be awarded by April 10th. Donating or applying at the Greater KC Community Foundation website. The COVID-19 Small Business Loan Relief Fund. The fund was established by AltCap in partnership with others, and the goal is to raise $10 million of capital to provide immediate relief to local small businesses experiencing economic disruption. In the first 48 hours, the fund received 500 requests for more than $25 million and is not taking additional applications at this time. Learn more about donating at altcap.org. This concludes my update on supporting functions and disciplines. In closing, I'd like to remind everyone that we have recorded this briefing. Check Prepare Metro KC YouTube channel for details. And I want to reinforce the Stay at Home KC message with three simple phrases. Stay safe, protect us so we can protect you. Stay strong, be informed, be positive, and stay home. It takes all of us to get together through this together. Thank you for your attention. This concludes our briefing.